Hello, everybody. We are so excited to be here today with you. As you can see, you are in the Mental Health 101 webinar hosted by Communities and Schools of Chicago. We're going to kick it off with introductions so you know who's speaking to you during this time and who we are. And so this is who we are. I'll let my colleagues start us off.
Hello, everyone. Thank you so much for joining us today. I am Shipra Paniker, the Senior Director of Intensive Student Supports at Communities in Schools of Chicago, and I am joined by my lovely colleague, Robin.
Oh my gosh. I am Robin. I'm Robin Kelch. I'm the Chief Partnership Engagement Officer at Communities and Schools of Chicago. And just really quickly, just so you know who we are, we've been in Chicago since 1988 doing really amazing work. And we support students through two proven programs, one that's really focused on connecting existing resources to our schools, and one that is focused on providing support to individual students. We were super proud to be in 250 Chicago public schools this coming school year, where we connect those resources. And at 40 of those schools, they will have an embedded staff member providing that tailored support. So reach out. Let's talk more about CIS if you would like to do that. But today we are here for Mental Health 101.
And that being said, our objectives for today are to recognize the signs and symptoms of mental health challenges that may impact youth. We're going to talk about the role of resilience and the impact of traumatic experience on typical adolescent development.
We're also going to look and learn to apply appropriate next steps in a crisis situation. And really importantly, I know some people roll their eyes in the back of their head, but please don't. It's really important that we practice appropriate methods for self care. So we will discuss that as part of today as well.
So, we're going to start off by talking about the impact of trauma and how it relates to our overall mental health. And if we're going to talk about trauma, we really need to start at the beginning in defining what trauma actually is. As you can see from this slide, trauma is something, an event, a life circumstance, a change. It's something that creates an internal or an external crisis. Trauma can be situational or maturational. Situational means that it's kind of the result of a one time thing, something like an event, not necessarily something that happens continuously or over time. A maturational crisis, however, is something that could happen over time or long term. Trauma varies from person to person. It is subjective. Two people could experience the same event and have a completely different trauma response. The intensity of trauma really doesn't matter. It's still trauma and it still impacts us. And ultimately, what trauma impacts is our normal functioning. So, kind of our day to day life. And it's really a deviation from our standard baseline, how we typically operate day to day. Two types of trauma that you may be familiar with are secondary trauma and vicarious trauma. Secondary trauma is the stress response related to indirect exposure to a traumatic event. For example, hearing about or witnessing a traumatic event. Vicarious trauma is the stress response related to exposure to someone else's trauma. And it really arises from that empathetic engagement with individuals who have experienced trauma. Secondary trauma and vicarious trauma are things that, as educators, as folks working with young people, or who even have young people in our lives, we may often experience. The trauma may not necessarily impact us directly through an event or something that happened, but we may take on that empathetic response to it.
All right, so now we're going to look at a little bit of data. So that was a lot of really great foundational information that hopefully helps us understand the different ways that trauma may show up. And this is an opportunity for us to look at the past year prevalence of major depressive episodes among US adolescents. So to be clear, this is not somebody saying, today I didn't feel very well. This is young people with an actual diagnosis. So that's important as we kind of dig in here a little bit and start to get curious about why we see some of the things we're seeing. So I'm going to orient us to this chart graph, and then we'll talk about some of the separated sex, age, and race and ethnicity in there, and we will learn things together. So let's look at this. Overall, 20% of young people surveyed had a major depressive episode as a diagnosis. Okay, so that's just baseline where we're at, 20%. Then let's take a look at the next area where we have the sex differentiators, female and male. I also recognize that that is not very inclusive of including some of our non-binary friends and other ways to define gender, but in this case, we're talking about sex. So we're just looking at female and male as the data is available to us. But having said all of that, huge difference here, right? When we're looking at this, we see 29.2 for female and 11.5 for males. That's wild, right? When we think about why this could be, do we really believe, do you think, and that's pretty leading, right? Do you think that there is that big of a difference between the ways that our young men and our young women are experiencing adolescence? Potentially. Or could this also be a way that we socialize our young people and having our young women have an opportunity to talk about their feelings more? It's more acceptable to do that. Tell us how you're feeling. And our young men to be told to, buck up. You're going to be okay. Everything's fine. Rub some dirt in it. Right? Like this idea, I see it play out in my own life. And I think it stands to reason that that could be the cause of why we see that huge differentiation between those two categories. Next, we're going to look at the darker blue area here on age. So we have 12 to 13, 14 to 15, 16 to 17. Very clear line here, right? There is a lot of obvious trend data here. We're seeing that these young folks, as they grow through adolescence, have more likelihood of experiencing a major depressive episode. Now, just like think for a minute about what that means, what's happening. I don't want to trigger anybody, but thinking about when you're 12 and when you're 17, what is being asked of you? What are you grappling with? And kind of where you're at in your journey of life. And what I think we can certainly say is that as our young people grow through school and get to those high school years, we're asking some pretty serious questions like, what do you want to do with the rest of your life? Decide now and then pick a college and go to school there, right? Like in CPS, we all know that there are opportunities for young people to test into schools. And so that part of that eighth grade even feels like that college moment. So there is more pressure on our young people, and they are responding in this way as those pressures mount. Additionally, they're also having some typical adolescent behavior that we will talk about shortly here. And lastly, on this last part here, we're looking at race and ethnicity. Some of that's cut off. So the first one is Hispanic, then white, Black, Asian, and then 2 or more. And this is where we really can start thinking about how culture impacts the way that we are accessing mental health care, the way that we are talking about it in our communities and with families and educators, and just the overall ability for us to accept that mental health is part of what we need to be thinking about for our young people and for ourselves. And so you can see clearly that the highest one here is the 2 or more ethnicities. And so you have to think about what that means for our young people and how they're experiencing their day to day, right? Does that mean that they are receiving more attention in a negative way? Could we surmise that there might be some of that going on? Do we think that maybe the reason why the Black and Asian ethnicities have a lower depressive episode amount is because perhaps in those communities it's not as common or acceptable to talk about this, or you might talk about it, but to go as far as to get a diagnosis, right? Let's remind ourselves that's what we're looking at here in terms of data. So a lot about data could go on for days. I hope I didn't lose you, but it's just really important for us to recognize what we're seeing and how we are treating our young folks. And this just kind of grounds us in the reality of what people are experiencing. Okay, so this is just an opportunity for us to ground ourselves in what is out there, right? The goal of this webinar today is not that we will diagnose anything or that we have any special information about these various disorders, but it's important for us to recognize that they do exist. they are happening, and that you might be experiencing some of this in your classrooms or in your schools. So briefly, we'll just take a look. ADHD, I hear about that a lot, very, very regularly, which also has this co-occurring anxiety disorder very often associated with it. Bipolar disorder, depression, eating disorders, psychosis. When we're talking about that, usually that's something as a what's that word I'm looking for? It's many things in one. It's not just one diagnosis on its own, and you don't just have psychosis. Um, and then substance use disorders. So these are things that are around, that you might hear about, that you might be experiencing, and we just want to kind of normalize that. Again, not expecting you to be an expert on any of that.
So now we are going to transition into talking about normal or typical adolescent development. We focus on this when talking about young people and mental health because we really want to understand what does typical development look like so we can better understand when a young person is deviating from that baseline. And that deviation could be for any number of reasons, but we won't know that it's a deviation unless we know what typical adolescent development looks like. So, we are going to cover 4 aspects of typical adolescent development: physical development, cognitive development, social development, and emotional development. Here, you can see some things that typically happen with adolescents in terms of physical development. Adolescence is a very challenging physical time. If you have ever met a teenager, you know exactly what this looks like. There are hormonal changes, increasing muscle mass and bone density. There's an increase in height and weight. Young people go away for a summer, they come back and they are 5 or 6 inches taller. And what happened? Oh my goodness. Their voices are deepening or potentially getting higher, and they are developing secondary sex characteristics. Physical development is also very obvious because it's all happening on the outside. So, this is something that we also have to consider that young people are noticing about one another as well, and probably comparing notes.
Yeah, I would say definitely, right? I'm thinking about
Mhm.
adolescent, thinking about middle school. Whoo!
Absolutely.
Oh yeah. All right, let's talk about cognitive development, right? This is where we're thinking about developing more of that abstract thinking, using logic and reasoning and decision making. We hope that's happening a lot. We also know brain development is active and ongoing and not complete during adolescence, right? Forming my own beliefs, questioning authority, I'd say, and this one for me is the one that is the most obvious that I can pinpoint. That, well, why are we doing that? Well, why is this? It's not a bad thing, right? It is challenging, but it's part of this adolescent development. You expect it, you should see it, right? And then again, this heightened focus on physical appearance and social acceptance. These are all connected, right? They're all happening at the same time. They don't happen in isolation. So it's not surprising that as we cognitively develop, we are also having a more heightened focus on that physical development as well. Social development. This is a big one, right? We know that for our young people, the ability to socialize appropriately is wildly important. We learned a lot of important lessons during COVID, right? So let's think about what that means and what we would typically see. They should be experimenting with different levels of social and cultural identity. I will happily share that as a young person going through adolescence, different versions. Tried on a lot of different versions of old Robin, right? There was the grunge Robin, there was cheerleader Robin, there was Grateful Dead Robin, right? I was trying on different versions of myself to feel what was right. And so if somebody didn't know me, they might be like, "Oh my gosh, she's like doing all these crazy things and I'm worried about her." But those that did know that that was my baseline and I was going through adolescence and I was properly socially developing. But also that learning to manage those relationships, increase in peer influence. Um, well, why can't I have it because everybody in my class has it and that's what everybody's doing, right? Like that's what of course, that's going to come up. Even in this picture here, this idea of social development being like, right, we're on our phones, we're looking at these things. We'll talk about social media as well. But, and also awareness of your sexual identity, again, how all of these things are connected, again, all happening at the same time. And then let's talk about emotional development. This is where we're developing a sense of identity. Our young people are thinking about who they are, what my beliefs are, how do I feel about myself. The moods shifting quickly in this slide is the one that I think, again, that we can really see and pinpoint and recognize in our young people in school settings, certainly, and absolutely just in life. Developing empathy, that's an important one, right? This idea of being able to look and understand how somebody else is experiencing something and maybe changing your behavior related to that so that you can resolve conflicts constructively. And again, just overall recognizing and managing emotions. I'm feeling sad, I'm recognizing this, and I have tools to manage it, is what we're hoping our young people gain during their adolescence. Okay, but here's the good news, everybody, and good news for you. Congratulations, you made it through adolescence, right? And most young people pass through adolescence with relatively little difficulty, despite all of these challenges, right? These people in this picture are celebrating their success in adolescence, and it's good to be reminded that while all of these things are happening, for the most part, our young people are they can thrive, they'll mature, and they'll increase their competence, their understanding of what this is, so then they can later apply it in other situations to be really resilient. So that's just we love a positive moment when we're talking about all the challenges young people are experiencing during adolescence.
And when we think about resilience, yes, absolutely. Like Robin said, our young people are resilient, and so are all of us, because, like Robin said, we made it through adolescence and we are successful adults, part of this world, contributing to our community and society. Things that can impact and do impact typical adolescent development and can impact that resilience for our young people and for ourselves are risk factors and protective factors. So, risk factors, as the name suggests, are things that can potentially have a negative impact on typical adolescent development. As you can see from this slide, some of the things that we consider risk factors are trauma, like we were talking about earlier, things like stressful events, abuse, potentially any medical conditions and hormonal changes that are really outside of the norm of that typical adolescent development, physical hormonal changes. A chemical imbalance, as we saw earlier with that data, there was a high prevalence of major depressive episodes for our young people, and that really is the result of a chemical imbalance. Substance misuse and sensitivity. Substances can, of course, alter any kind of typical development. We're not going to go through, or I'm not going to read off all of these, but we do just want to put this up here as things to consider as impacting or having the potential to impact that typical adolescent development. But moving on to protective factors, these are things that can positively impact that typical adolescent development. Things like good problem solving skills, a consistent home or family routine, having a good social support system, and we as caring adults are all part of that social support system as well. Availability of constructive recreation, having something to do that is positive outside of school. And the one I love to point out is feeling close to at least one adult. And that's what we're all here for. We are part of those protective factors that can help our young people develop really as they should be developing.
Yes, I love a positive moment and a good reminder that you are doing this, right? You're watching this webinar because you're a caring adult who's trying to do the best that you can for young people and for your community. And so we applaud that. All right, let's talk about social media for a hot minute here. So here's some information that surprises exactly 0 people. More than 9 in 10, so 10 teenagers report and young people report using social media sites such as these, right? Over 80% say they use it daily. I would venture to say, in my social circles, as young people are going through their adolescence journey, that the older they get and the more independence they get, if they have access to a smartphone, that they're on it a lot, more than 80% daily, I would say for sure. In thinking about how we've shifted, how we think about even social media as a tool, as a teaching tool, right? There's different ways that social media has presented itself, and I want to be reminding all of us that it's not all doom and gloom, right? It's not all bad. It is something we should be cautious about. We know from the Surgeon General on down to our own experiences how this impacts our young people and ourselves. So what I like to point out when we're at this point in our training here is that this is part of your self-care too. We'll get to the self-care piece here, but I implore you to think about how often are you on social media? How is it impacting your mental health? And think about how that exponentially might be impacting a young person as their brain and is still developing, right? The idea of being familiar with social media sites can be helpful just so that you've got your finger on the pulse. Nobody expects you to join the whatever, the Instagram crew group or whatever. I don't know what I'm talking about. I'm obviously not cool, but you're cool and you would know those things, right? Keeping your finger on the pulse and being aware of what's going on can be really helpful so that if a young person does open up to you and wants to talk about something, you're not like, wait, back up. What's that again? Right? You be a little bit aware, but you don't need to be on social media 24 hours a day to be aware. Take care of yourselves. Okay, we're going to dive in now to signs and symptoms of mental health challenges. This is where we start to get information a little bit more specifically on what things are looking like, what should you be aware of, what should you be doing, what should you be saying, right? We're going to get pretty tactical here, so let's dig in.
So, signs are things that we can see or observe that indicate a physical or mental problem in the body. It's again something we can observe or see very clearly. Symptoms are indicators of a physical or mental problem that a person can feel. Symptoms are more something that someone else has to describe to you. So if you can think about any time that you have visited a medical provider, they're going to ask you, how are you feeling? What are some signs and symptoms of how you have been feeling? Symptoms, again, are things that we need to describe a little bit more, but signs are things that we could observe. So, feeling or being really tired, being disheveled, coming in unprepared to class, or consistently late, not having everything that you need. Those are some really easy examples of signs that may indicate a larger, more concerning issue. We also want to differentiate between that typical adolescent behavior and a potential warning sign. I love this slide because it really lays things out very, very clearly. So, for example, typical adolescent behavior is withdrawing from family to spend more time with friends. Over the years, I have heard parents and families complain about this all the time. My young person doesn't want to hang out with me anymore. They only want to be with their friends. They don't want to be with me or the family. That's typical. That's normal. They should be doing those things. However, a potential warning sign is when a young person is withdrawing from everyone. So, family, friends, they're not engaged in any social activity. We may see them kind of in their room a lot, or really just that isolation from everyone. So, again, typical behavior is wanting to spend more time with friends, that peer influence, all of that is coming into play. And a warning sign is withdrawing from everyone and not really engaging in anything. Another example that I commonly get questions about is moving from childhood likes to teen pursuits. My young person doesn't like the things that they used to like. What is happening? That is typical. That's normal. They should be kind of replacing interests. Something that may have interested them when they were really young is not going to necessarily interest them as they grow into adolescence or into adulthood. A potential warning sign, however, is losing interest in favorite activities and not replacing them with other pursuits. So, again, this young person might be isolating, they're not really engaged in anything. They're not interested in things that they were interested in before, but they're also not exploring anything new. Those are just two of these examples, but of course, we have the slide here for you all to look at the rest.
I jumped the gun. I'm sorry. Here we go.
Okay.
Now we're ready. I get excited, and I know that this might sound strange, but this is one of my favorite slides. Of all the presentations I do, this is one of my favorites, and I'm going to tell you why. Because it's really concrete in a world where there's so much gray area as appropriate, right? How do I know if a young person is really having a challenge, or is this just normal, right? We've went over all of these things. How can I know, right? This is a great thing to remember. So you guys know about the FBI, right? The Federal Bureau of Investigation. We're not FBI agents. We're FDI agents. Come on, guys, stick with me. It's so good. FDI, right? Frequency, duration, and impact. Frequently, how often is this happening? Once a day, many times a year, 6 months out of the year, a week, what? For the duration, when it's happening, how long is it happening for? It happens once a day for 6 hours. It happens once a week for an hour, right? And then what's the impact of that? Does that young person stop doing their normal activities, that baseline that you know of? Are they not coming to school? Are they not managing relationships? Are usual activities not happening? These are the things to keep an eye on. When you put all of these together as an FDI agent, you have a really good sense of what's going on and whether or not a young person is having a challenge. So congratulations, you're all FDI agents. You're welcome. We are going to dive in now to next steps and action planning. And we are going to encourage you all to make sure that you are taking care of yourselves. We're going to talk about topics and issues that are serious and it can be difficult. And we want you to, in a webinar, pause, right? Take that break that you need and make sure that you are taking good care of yourself. And we'll talk even more about that as we finish up this section here. So in next steps and action planning, the first thing that we're going to talk about is one of the most difficult things to say. This is when you are concerned enough for a young person that you think that they are at risk of suicide. Okay. And so you really need to be clear and intentional about the words that you use here. Okay. So that's why on this slide it says, ask the question, are you thinking about killing yourself? Do you want to die? These are two different things that you could be thinking about as a way to use that language for something as serious as a young person dying from suicide, right? I paused there because I didn't use the word commit. Let's think about that for a second. This is an opportunity for us to get rid of some stigma. When we think about the word commit, we use that word in other contexts, right? We commit a crime. You are going to be committed to an institution. These are really negative connotations, and we can do our part to changing that and reducing the stigma by saying things like died by suicide, harmed by, impacted by suicide if you're part of a family member, things of that nature that don't make it seem so black and white as commit, right? Having said all of that, I implore you to practice saying that sentence out loud. Are you thinking about killing yourself? Ideally, you say it to a friend and they say it back to you because you need to know what that feels like in your body before you actually have to say it. As somebody who said it right now, you might even notice my demeanor changes a little bit, right? It's not, it's heavy. It's heavy to think about. And when you have to say it to a young person in that moment, you want to know what your body is going to do and how you're going to react. So please practice. But here we're talking about if the answer is yes, you've gone and done all of these things, you've asked the question and the young person says yes, you have additional work to do. You have to ask the person, have they decided how they're going to kill themselves? Have they decided when? And have they taken steps to secure the things that they need, tools needed to do such things? Higher level of planning means higher risk. Of course, right? If a young person says, yes, I am thinking about killing myself, yes, I have decided how, yes, I know when, and yes, I have what I need, that's obviously a much higher level of risk. However, lower level of planning does not mean there's no risk involved at all. I like to remind folks that if you were worried enough to ask the question, then you're worried enough to stay involved, right? It doesn't just go away if the young person even says no, right? You're relieved. I'm relieved. But that doesn't mean there's no risk involved. Okay. So ask the question, practice what that feels like, and also recognize that lower level of planning does not mean there is no risk. I feel importantly to say out loud now, as related to your work as Chicago Public Schools employees, you have very specific rules to follow when it comes to suicide risk assessments, all of this. So please, the other part that I would love for you to do in addition to practicing is that find out what your school's exact procedure is and make sure that that's really clear. Okay.
Absolutely. And that is one of the things to consider when reaching out. So, like Robin mentioned, at this point, when we're talking about next steps, we are concerned enough about a young person to ask if they are thinking of harming themselves or killing themselves. Things to think about absolutely are the protocols of your school. Are you the person who can and should be asking these questions? Or is this a place to refer someone to a school counselor, a school social worker, a school administrator, another behavioral health provider on site? So, again, like Robin said, please do talk about what your crisis protocol is, especially in the event of this kind of concern. Some other things, just in general, to consider is really the relationship that you have with this young person. So, thinking about, is this within the scope of your role? And also, do you have the kind of relationship with a young person to really sit and have these more serious or difficult conversations? It's okay if that is not your role and if you do not have that relationship with a young person. That is totally fine. This is a place to definitely involve others because if you notice something and you are concerned, it's absolutely important to say something, even if it isn't to the young person directly. Something that Robin mentioned earlier, and something to keep in mind, we were talking about when we reviewed that data, are cultural considerations. So we noticed that some racial or ethnic groups may have had that lower prevalence of a diagnosed major depressive episode because culture may play a role in this. I often share that growing up in a South Asian household, whenever I said I was feeling sad or upset, my very Indian mother would respond with, "Have you had any water today? You're fine. Just drink some water." And it helps 90% of the time. And also, we know that mental health and mental health challenges are much more serious than drinking water. Thinking about the young person's right to privacy, of course, our young people do have that right to keep things confidential, and there is a line with that. If a young person is thinking about or planning to actively harm themselves, we do have to think about where is the line and who do we need to involve and when. And last but certainly not least, thinking about your ability to help. The last thing we want to encourage anyone to do is to start engaging in any of these conversations and then immediately have to cut them off because you have another class that's starting in 5 minutes, or you have to go to that meeting, or it's so close to the end of the school day and you have a commitment right after work. So definitely thinking about your ability to help, especially in that moment. Some other things as we're thinking about, assessing for any kind of risk of suicide or harm, factors that can increase these risks for young people are really like a lack of awareness of the risk involved. So thinking that self-harm really isn't a risky behavior, everything is going to be fine, kind of downplaying that. The influence of peer groups absolutely can be a risk factor, not always, but it can be. And the use of alcohol or other drugs. Of course, as alcohol or any other substances can alter our brain chemistry or just how we're feeling in a particular moment, it can also increase that risk of any kind of harm to self or potentially others. So these are just also some things to keep in mind.
All right. Other important things to keep in mind tactily when we think about how we're going to approach a young person. You heard Shipper talk about considerations when reaching out and some really important aspects there. I'm going to try to tie that into this as well because they're all related and they're all happening again at that same time. So when we're thinking about how to listen, right? We're how to be a good listener, how to do that, how to show a young person that you're listening and that you're doing so in a non-judgmental way takes practice. Okay, I hear myself, but it really does. So we want to use I statements. We never want to say, you've been acting crazy and I don't know what's going on with you, but like you need to figure it out. That's a lot of you, right? I might say, I've noticed that you have not been acting like yourself lately. You've missed a lot of class. I'm concerned. Is everything okay? Very different ways of approaching the same problem, the same young person. Not that the young person is the problem, but the problem that the young person is having, right? Ask questions, but don't push. They say, yeah, I haven't been feeling really great. Maybe you ask, how long have you been feeling this way? And they're like, I don't know. No, seriously, tell me how long you've been. You don't need to push, right? It's about this young person. It's not about you. You got to take your ego out of it and really be present for somebody else, right? It might be really relieving to just have this conversation. A young person might be waiting for someone to ask them the question, to give them the space to say what they need to say. And so you can be that, right? We saw that in our protective factors. That's you. That's the caring adult. And so ways that we can work on being non-judgmental is reminding ourselves of these bullet points down here, right? Their experiences are not the same as yours. I know it feels like it's the same. It's a breakup, right? That's a classic. It's just not exactly the same because you're not them and they're not you, and it's a different time period, right? Um, you have to consider again the cultural considerations of what a young person is experiencing, how they're experiencing their home life, and what's appropriate and not appropriate for that young person. And really, they need our empathy, right? They need us to be empathetic. That's this idea of showing up to be there present for somebody else. Something I like to remind us, and the shipper really talked about it, but I like to bring it together in what I call check yourself. Before you dig into a conversation, or you're going to approach a young person and say, I've noticed these things, so that you can listen non-judgmentally, check yourself. Are you the best person to have this conversation? Shipper talked about it, right? What's your relationship with this young person? It doesn't have to be you. I might be concerned, but Shipra might have the relationship. So I might talk to Shipra, say, I'm noticing these things about Tina. Can you maybe talk to her about it, right? That's still doing your part, right? So are you the best person? Can you actually check your judgment at the door? Can you really not make a face when that young person says the thing or the thing that you think that they shouldn't be doing or whatever that is? Can you? If not, phone a friend. You're not the one to do it. And that's okay. Phone a friend. Lastly, do you have the time? Shipper spoke about it so beautifully, right? You don't want to have done all of this. Get a young person in a space where they have privacy, using I statements, really focusing on all of these things that we were talking about to provide that space for a young person to come forward and speak to you and then say, oh, hold that thought. I gotta go. I'll see you later, right? We don't want to be doing that. So those are really important things to keep in mind when we are approaching our young people and listening non-judgmentally. Check yourself, FDI agents. Okay, and now we can get even more tactfully, right? This is opportunities for us to think about how to effectively communicate, really bringing all of those things together that we've been talking about. I'm going to focus on just two right now for the sake of our time together, and that is be comfortable with silence and be accepting even though you might not agree, right? So they could go hand in hand, right? But being comfortable with silence, maybe I bring that up because I struggle with it a lot. Oh, I really do. And especially when I'm talking to a young person and I've kind of got this hat on and I'm anxious. I want them to be well. I want them to know how much I care. And so sometimes that means not saying anything and letting those words live in the air. Okay. So practicing being comfortable with silence is a great way to effectively communicate in any context, really. And then the idea of being accepting, even though you may not agree, it doesn't mean you're condoning a behavior. It just means you're accepting what's being given to you right now, even though you might not think it's the best way forward. All right. In order to do that, how do you show that? You're aware of your body language and your facial expressions, right? That's when we talked about checking yourself. Can you check your judgment at the door? Can you have body language and facial expressions that are allowing you to be fully present and show that young person that you are fully here, right? So listening non-judgmentally does take practice. Effectively communicating does take intentionality. And lastly, I'll point out that many of the things on this list here happen unintentionally, right? Be careful about using slang. You might not even realize that's happening, right? But that's where that intentionality comes in when we're working with our young folks.
Something that we also want to do is to give reassurance and information. So, giving reassurance and information is not the same as giving someone advice. It is really easy for caring adults like all of us to want to jump in and problem solve or help a young person feel better, make promises that everything is going to be okay. And that is not always helpful. It might feel helpful in the moment for us, but we do want to be realistic to reassure a young person and to provide them information or, the potential for any kind of information. So, some examples here are have realistic expectations. We might say something like, I'm not sure what's going to happen, but I am here to support you. What we don't want to do, like I mentioned earlier, is to make promises that we can't keep. We don't want to say things like, everything is going to be okay, it's all going to be fine, because we really don't know what the outcome of a particular situation is going to be. We do want to give the young person hope. So, saying things like, I believe that you have the capacity to deal with anything that comes your way. That's hopeful. That is also not a lie. And we would not encourage you to say it if you don't believe it. But we don't want to do things like dismiss the problem or emotions. We also don't want to try to fix the problem ourselves. That's also not helping to build any of that resilience with our young people. And we don't want to engage in communication that is sarcastic, hostile, or patronizing. This one is difficult for me. I love to use sarcasm, it is my default form of humor. And young people do not always get or appreciate sarcasm, and it is not always appropriate. So it's important for us to think about how we're giving that reassurance and information as much as what we're saying. So, what we're saying and how we're saying it.
Let's put that into action, shall we?
Absolutely. So, something that we really love is this slide where it kind of compares giving reassuring information versus advice. So, some reassuring information saying things like breakups can be tough. It's natural for you to be hurt and upset.
And advice, and maybe even a belittling tone might sound like, oh, I remember my first breakup. Here's what you need to do. Grab a pint of ice cream, grab a John Cusack movie, you'll be right as rain.
I don't even know if our young people know who John Cusack is.
Well, that's
It's
part of our role as a caring adults then, isn't it?
to educate them, right?
Yes.
Something else that we like to say is you are not alone. That is giving someone some reassuring information.
Another way to say that could be, you'll get over it. Just don't worry about it so much. You're fine, right? No big deal.
Absolutely. So it's important for us to think about those differences again between giving reassuring and realistic information versus giving someone advice. This is going back to what Robin was saying earlier with listening non judgmentally, where this is not about us. This is about the young person, what may have worked for us in terms of a breakup, eating ice cream, watching a John Cusack movie, whatever the case may be is not necessarily going to work for this young person. But we can say things like, you are not alone. It's natural to feel however you feel. And I am here for you. If you want to talk, I'm here to support you.
Yeah, I love leaving that door open. That's an important one.
Absolutely. Something else that we want to do with our young people is to encourage that resilience. This is also why we don't want to try to fix a problem ourselves or give them too much advice. We want to encourage our young people to problem solve for themselves. There is always going to come a time where our young people are not with us every single day. They're not with us in the classroom. They're not with us at school. I think about right now, it's June. Our young people are out for the summer doing whatever they want to do. So we want to prepare them with those self-help and other support strategies. Things like exploring activities that might help to manage any of the symptoms that they're experiencing. Something that we talk about a lot is when exploring activities, thinking about and exploring things that are at no cost and things that can be accessed in the moment. So for example, if a young person says, "Oh, it really helps me to go to the movies." Okay, well, when you're in the classroom and you're feeling some type of way, you can't just get up and leave and go watch a movie. So we want to think about things that are really accessible. We also want to find strategies that interest the young person. We know that young people are not going to do things that they do not like or want to do. So, encouraging that exploration of strategies that are interesting, that are engaging, that may really appeal to a young person so that they are consistently using them. The last thing we want is for someone to try a strategy that really just doesn't work for them because they won't continue to use it.
Okay, now we are going to talk about self-care for adults. That's you. And I know when I say self-care that some of you are like, "Oh my God, can I fast forward? Can I get the playback speed to go faster in this?" No, stick with me. It's vitally important. And it's not just a buzzword. It's really, really important because you can't pour from an empty cup, right? I know you know these things, but we're going to just like really dig into it for a minute here, okay? We know that it's the practice of taking action to preserve or improve one's own mental or physical health. We're actually going to take that a step further in the next slide. Um, but what's important to remember too in your roles and in working with young people, that when you are implementing some of the things that we've talked about today, uh, it's normal to feel scared, exhausted, or emotional after providing this support. So just be aware of that. Something I like to remind folks, especially in school settings, is who are your go-to people? Who are the folks in the school building that you count on for that quick aside, for that break in the whatever, for the quick text? I don't know, I'm making stuff up. But whoever that is, whoever they are, think about that and then tell them that they're that for you. And then offer to be that for them, right? You've just created a support system in the moment that's not about long-term support for yourself, right? Like Chipper was saying, if you as an adult, one of the things that you like to do to keep, to have self-care is take a nap, go for a run, go to Pilates. In the middle of your school day, when you're heightened or you've had to, give some of this care to somebody, you can't exactly do that, right? So what are the things that we can think about in the moment that can be part of your support system? And that's also part of professional resilience. But as I said, we're going to take it one step further. So, what I love about this is that it's a reminder that yourself, you as a human, have all of these different facets about you, and your self care might look different depending on what your needs are and what's happening for you in that moment. So, your environment is your space need something different? Do you need to do something different with that space? Your personal care, right? I mean, I would love to be able to have a watering can so that my hair would grow. I think that's what that's saying. I'm trying to grow my hair. It's very serious, right? In your professional world, do you need to separate? Do you need to put boundaries up? Do you need to think about what that looks like? Have you told your support system that you're your support system? That could be an active thing to do towards taking care of yourself in your professional environment. And then you see others, right? Mental, financial, physical, social, spiritual, all important, all part of what we need to be doing to be our best selves so we can keep showing up for others, but that we can also thrive, right? That's okay too.
Absolutely. And this is a place where we also like to encourage folks to take a look at what your benefits cover. If you have an employee assistance program, take a look at that. Some insurance plans will cover different things like a gym membership or therapy or a certain number of sessions with different folks. I believe our insurance, for example, also covers appointments with a dietitian or a nutritionist. So being able to kind of take care of your physical health in different ways. One of our colleagues also likes to say that a way of taking care of yourself financially is to continue contributing towards any kind of retirement, pension, 401k, saving whatever little bits of money that you can for the future is really another form of self care, whether we all think about it consciously or not. And that being said, thank you for staying with us. We are so close to the end. So, we just want to recap with a couple of key takeaways. One of the things that we talked about today is really paying attention to what might have changed for a young person, thinking about that typical adolescent development, what may be a deviation from that baseline, what are signs and symptoms, how could we potentially notice those or talk about things like frequency, duration, and impact? Asking and assessing, asking those tough questions. If we are concerned about a young person, we've noticed all of these things because we've been paying attention. Asking explicitly, are you thinking of killing yourself? Or following your school's crisis protocol to direct that young person or take them to someone who can ask those tough questions. Listening without judgment, this is good practice in a crisis situation related to mental health or not. Reassuring and not necessarily giving advice. We are there to help and support, not to fix, not to problem solve, but to really be with someone in the process so that they're seen and heard and supporting them in getting what they need. Connecting. So if you see something, say something, and taking care of yourselves. This work is really difficult. Giving so much of ourselves to others is exhausting. And so we definitely want to encourage that self care and really that practice of ongoing wellness for ourselves.
And with that, y'all, thank you for being present with us today. We were really honored to be able to do this, and we hope you've gotten a lot of good takeaways. So thank you so much. This is Robin and Shipra signing off.
Thank you.
Thank you.